We are very excited about this new aortic valve procedure at Scripps. We've been working on it now for several months. It's very new. There's only a few centers in the country that have access to it. Very complex, requires a lot of expertise in the operating room and in the catheterization laboratory. The exciting thing is that we're able to actually replace a patient's aortic valve without opening their chest. It, to me, is just amazing. Because it's not a small little stent we're putting in, it's a pretty large valve. And yet it collapses and wraps down on a balloon fairly tightly so that it's fairly small, and it's going to get smaller over the next couple of years. And we're able to actually thread it up through the vessels in the leg to the heart, across the patient's own aortic valve, and then deploy it, expand it within that valve, right inside the patient's normal aortic valve, or abnormal in this case aortic valve, to give them a brand new valve. Once this is implanted, it functions perfectly. It functions just like a surgeon had opened up the chest and put in a new aortic valve in.
Standard aortic valve replacement is a fabulous operation for aortic stenosis. It's literally life-saving, and it's almost curative. I mean, the valve prosthesis functions immediately. The heart is immediately relieved of the obstruction, and the patients live much longer than if they didn't have it fixed, and it's a great operation. Why would a heart surgeon want to embrace a technology that takes away, what we typically have been doing for patients with this problem? And the answer is, I think, looking for what's best for the patients long term, what's best for morbidity and quality of life, and get back to full speed, so to speak. If you can have a less invasive, smaller incision, sort of less natural trauma, patients probably will recover faster and probably will get back to full functional speed sooner. This is just another way to try to see if we can get the same clinical results, same patient benefit, with a less invasive platform and easier recovery for the folks.
The exciting thing about this new technology is that while it's not inexpensive and it's not a simple outpatient procedure, it cuts the hospital stay from about a week or maybe sometimes 10 days down to about 3 days. So we're very excited. This is a major breakthrough in cardiology, and it's a major breakthrough in medicine.